Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center here in Southern California, Tustin, California. And we are Ask the Doctor Anything. And we are a group of functional medical doctors, healthcare providers. There's a group of 7 or 8 of us here who are interested in trying to use natural lifestyle changes before we have to use standard of care medical training wherever it's appropriate. So we are opening this up for questions. They're not meant to be personal medical advice, but this is more for educational and general information. So if you have a question, we'll tell you how we would look at this from a functional point of view. But again, if you have a problem, please see your doctor, and please go ahead and connect with the front office if you are one of our patients, and leave a call and we'll get back with you personally. But again, this is general information, and if this is valuable to you, please share this, like and subscribe, hit the like button. That helps us. And we have email questions that go out. I have several pages. Hopefully I can get through them all. We also have the live YouTube chat, so you can type in your question for those of you who are watching live with me on these Tuesday nights at 6 o'clock. We meet every Tuesday at 6 p.m. And I will defer to those questions first before the emails. And let's go ahead and give it a start. Let's see, on the chat we have Tara. Tara says, hello, Dr. Rita. What brand of EDTA do you recommend in oral form? Also, have you seen other chelators like DTPA cause actual damage if done in very high dosage or with a weakened blood-brain barrier? Thank you. Tara, I don't have a brand of oral EDTA that I recommend because I've been around chelation since I was around 6 or 7 years old. I'm now 70, so that's 63 years of experience. And I've been with training with some of the greats throughout the world regarding EDTA chelation. I teach EDTA chelation. So what I would suggest to you is we have found through our personal clinical experience that there is very poor absorption with the oral form of EDTA, calcium disodium EDTA, or disodium EDTA configurations. It's such a big molecule, it's not going to get passed through the gut and absorbed, maybe at best 5%. Now, will it have any value passing through the gut? Probably it will have some value, because all foods, all the plants have showered down upon them the nanoparticulate heavy metals that are toxic in these chemtrails in the sky, which have aluminum, strontium, barium, and other heavy metals in them in such tiny levels that they become dispersed in the upper stratosphere, 50, 60,000, 70,000 feet. And we are able to bounce radio frequency waves off of them, which can heat up and create changes in atmospheric lows and highs, and therefore impact weather. And this has been studied since 1927. So we have at least 100 years as a nation doing this. So this is no surprise. But they have to have these metals. So if you eat something, because it'll fall down on your organic garden in your backyard, it will be taken into the animal who eats the grasses. And so possibly some oral form will help chelate some of the volume of your daily exposure. But as far as where we're at, we're dealing with people who have been bioaccumulating heavy metal toxins, these free radical oxidative agents, breathing them in, drinking them in, eating them every day. And they bioaccumulate because we have no real natural way to detox we grow our hair out, and it's in our hair, it's in our skin epithelia. We exfoliate, and so the rate of accumulation compared to our ability to get rid of any of this is a net negative. So we're bioaccumulating it. By the time you get older, that oxidative stress is going to generate these cell membrane damages over and over again from something maybe you ate 20, 30 years, 40, 50 years ago. Free radical damage here to the membrane of the cell. And you have to repair it by eating the phospholipids and things that you must have to repair that membrane wood. But your white blood cells are not going to eat a heavy metal. The heavy metal wins the war. The white blood cell will be hurt. The membranes will be punctured. So no, I don't have anything on that. And yes, I have seen some toxic side effects, none of them serious, with the other forms of chelators, because there are that are man-made, and I don't use them. And I don't use them for the reason that EDTA chelation is ubiquitous in removing all forms of these cation, positively charged, toxic heavy metals. So why would I take a trial on something when I know my EDTA chelation is going to work? So I'd rather be safe, slow, steady, and sure without any problems than to try other things. Now, there are oral things like chlorella, cilantro, high-dose vitamin C, other items that are out there that are chelators too. But again, the net effect of comparing oral natural chelators like cilantro or chlorophyll to EDTA chelation, there's no comparison. EDTA is so safe. We have FDA approved it for removing lead to save the lives of children who accidentally eat some of these lead-based paint chips that are still around in the world. All right, hopefully that helps you, Tara. Jules Z says, questions, what is an alternative to taking antibiotics post-colitis or intercourse? 2 years and 3 specialists. This is what the infectious disease doctor has prescribed to proceed in hopes of preventing recurring urinary tract infections. Well, we would suggest that you might consider using D-mannose. D-mannose is a type of sugar in which you put it in water and you drink it, and it isn't absorbed into the body. It's kept such that it will be poured out into your urinary tract system, and D-mannose will line the bladder, which will make a bacteria unable or very less likely to attack the lining of the bladder. So D-mannose can be taken on a preventative basis regularly. I know of no long-term negative effects. I use a product called Uretrex, and cystatin is a cranberry concentrate. Cranactin is a, I think the trade name is cystatin. The cranberry extract helps prevent bladder infections. Of course, drinking plenty of water, of course, good hygiene after intercourse, and then try those things as well. Hopefully that'll be a help. Jules also added 32-year-old female, otherwise healthy. All labs are perfect. Thank you. Yeah, so that probably should be something you could try so you don't have to use antibiotics after sex, and discuss that with your doctor. And that's what we tend to do here with our patients. Okay, so let's go to some of our email questions. The first one I have here is from Lynn. Lynn says, hi, Dr. Rita. I'm 64-year-old female, currently taking bioidentical progesterone and estrogen. My testosterone is low, 2.7. I've tried shots, creams, and now the melts under the tongue. But upon taking any of the forms, my weight jumps up. So I stop. Any insight you can give me? Now, let's see. So you're saying all the bioidentical hormones are associated with this, or just the testosterone is what you're focused on? Um, because you could use DHEA, that's over-the-counter dihydroepiandrosterone. I use it 50 milligrams, and this helps my testosterone be in a robust range of, like 70, 80, 100, so that my muscles and my weightlifting 3 times a week is much better. If you're adding all of it together, saying progesterone and estradiol, I would say if you're concerned about your weight, there are so many other things that are of concern here. I would want to know your lifestyle, your stressors, your cortisol level, your DHEA level, your inflammatory markers, your food allergens. I would like to know your fasting insulin. I would like to know your triglyceride level, your hemoglobin A1C, and your fasting blood sugar. All these things plus others are far, far, far more impactful. Your body mass index for your muscle volume. If you have a very low muscle component of your weight, you've got to work to build up your muscles as well. So I don't find anything but benefits from natural bioidentical human hormone replacement for longevity, beauty, health, maintaining a good weight, and so forth. So I would use them and see a good functional doctor that will try and look at the whole picture, looking at your thyroid inflammatory markers, autoimmune to thyroid peroxidase, thyroglobulin antibodies, and try and put this whole picture together for you. The next question is from Dawn Marie. Do you have any suggestions for my 11-year-old grandson who takes Vyvanse for ADHD with fair control for only 6 to 8 hours and has severe problems in getting to sleep at night? Would melatonin help? Is there a better melatonin than others? Thank you. Always appreciate your guidance. Well, Dawn Marie, Vyvanse is, a stimulant, and we would hope that he could get off. We do find that if there are food colorings, food dyes, if he's getting into this in school, in some of the school foods, these are irritants, agitators. They have neurochemical impacts. Even diet sodas, the aspartame and neuro agitators, excitatory. So natural things that can be looked at if you can find a pediatrician who will look at food allergies on your child with a immunofood lab for IgG and see if he's eating something that is agitating him with leaky gut. Very often we find if the child, if we can find out his blood type, if we can help him with probiotics, with a methyl B complex, get his vitamin D level up to, an 80 nanogram per deciliter. If we can give them the essential oils that help build the membranes. Remember, these membranes right here for being agitated are indicating if there's a lot of holes poked in them from these excitotoxins and toxins punching holes through the membrane. That means they need a lot more healthy fats and saturated fats and cholesterol, as well as the essential fats that go into the membrane, the linoleic and alpha-linolenic acid. We use here clinician's preference oil, which is rich in alpha-linoleic and linolenic acid. omega-3 and omega-6s. These are unadulterated, meaning they aren't hydrogenated. So get rid of the processed foods, get the essential oils in, not fish oil, not DHA, EPA. Get a probiotic in, reduce the sugars, and get him eating natural fruits, and try and get away from processed foods, and see if these things, along with much more healthy fats, will help him get a food allergy test. And that's how I would start with him anyway. Hopefully that gives you some starters. Art has the question, why does it seem like my vision improves when I'm fasting? Is that just a coincidence? No, it's not. Because when you fast, remember your eyeball has the vitreous fluid inside of it. And that is really a protein matrix solution. And those pieces of protein, if we don't drink enough water and we eat too many sugars, can get sticky, and you can start seeing some difficulty with some of your fine vision. So fasting creates what we call autophagy, and that eats some of these little protein complexes up. That's why I strongly recommend everyone in America, unless you have some, unique medical problem like an insulin-dependent diabetic or so forth, or you're fighting cancer and having trouble maintaining your weight. But for most of us, we can do intermittent fasting. That is where you restrict your eating time to a set period. So maybe noon to 6 p.m., some people 10 to 4. And this is absolutely a real thing, that your vision improves when you fast. I had a floater in my left eye, I don't know, a year and a half ago, for the first time. And it was rather big and a nuisance. When that happened, the first thing I did was fast for 5 days. 5 days I went on a water fast. And that sucker got chewed up and dissolved to the point where I would say it went from down about 85–90%. So indeed, fasting does help. Don says, are doctors able to identify early signs of PCOS, polycystic ovarian syndrome, in young women before full-blown insulin resistance and high testosterone indicates a problem? How do doctors diagnose endometriosis? Well, they could if they taught them preventative medicine. And that's what functional medicine, that's why we do these question and answer things. You can get a HOMA-IR, HOMA dash capital I, capital R, and that's a homeostasis insulin resistance predictor. And if you take your fasting blood sugar and you multiply that by your fasting insulin, and if you're using milligrams per deciliter like we do here in the United States versus England, they're on the metric system, divide that by 405, 405. So your fasting insulin times your insulin fasting divided by 405. And guess what you'll find? We found out that all these years, these decades, I've been being low carb, no carb, long before there was the bulletproof coffee and the keto diet. I've been preaching this for years and years to my patients, decades. I was always telling my patients, you want your fasting blood sugar 85 or less, and you want your fasting insulin 3 or 4 or less. And if you do, you can do this, multiply 85 times 3 or 85 times 4, divide that by 405, and the number will be less than 1. It'll be a 0.6 or 7 or something like that. If you're under 1, you are not developing insulin resistance. And in America, with the American marketing, pimping, pressure, social, to get you to buy and eat, buy and eat, buy and eat, eat this processed junk, hydrogenated, genetically modified foods. If you can resist that and have that checked once or twice a year, once a year or every 6 months, you can see if you're moving toward insulin resistance, which leads to all these diseases: cancer, diabetes, cardiovascular disease, polycystic ovarian syndrome, osteoarthritis, autoimmune, emotional disorders, depression, obesity, hypertension, and the list goes on and on. And so, by the grace of God, we just watched our patients and we figured this out decades ago, decades. And so, praise the Lord. That's how you can do it. And how do doctors diagnose endometriosis? Well, they really do it by poking a hole through your stomach called a laparoscopic exam. And they blow it up with some CO2 and they look around with a light in there and they'll see little implants of the endometrial implants on, your bowel and your omentum and various organs like that. And that's just from the chronic stimulation of insulin from eating a high carb junkie marketed, pimp to you, social pressurized behavior to get you to eat. So don't do it. Barbara, I got COVID for the first in mid-July. While I have tested negative for months, I am still experiencing extreme fatigue and muscle aches. I know there are theories about viral persistence as well as microclots as the reason for lingering COVID symptoms. What are your thoughts as to the cause and what suggested treatments do you have for this? Well, there's a lot of concern about the validity of the COVID test. Remember all the way back, Professor Kelly was his name, who developed the PCR test. I don't remember his name right off the bat, but he told us never to use the PCR to diagnose any disease. And the threshold of counts is very impactful, and they use thresholds that way exceeded what would even be marginally considered beneficial to try and become diagnostic using a PCR. So we were at 35, 40 thresholds when you really never should exceed 20. Then there's all the concerns about the testing. Remember there were some of these people who were heads of state in foreign countries, and they tested goats and mangoes, and the goats and mangoes were positive for COVID. So there is so much corruption in the scientific communications now and censoring that it becomes concerning. Therefore, I don't have confidence in that test. Now, regarding the fact that some people after cold-like symptoms, where you get flu-like congestion, cough, achy, myalgias, fatigue, shortness of breath with exertion, runny nose, fever, low-grade fever. This happens with really most any viral flu. And normally in 7 to 10 days, if you're healthier, 3 or 5 days, you get better. So this seems to have some concern about being that it was designed possibly. There's a lot of literature saying this is a designer virus, and that the spike protein that is produced by seizing your own internal cellular machinery, you reproduce the spike protein component of the mRNA, if that is indeed the virus, if that is indeed what you had. And then they're finding research that shows in the lymph node T cells, mesenchymal cells, that there are spurts of production still, because no one knows how long that mRNA can be read by your own machinery over and over again that generates this producing spike protein. This spike protein then itself attacks the epithelium, ACE receptors, and other parts, and can get to, it doesn't stay localized as they had first reported, and it can cross barriers, membrane barriers. And so we might be getting these reproductions of the spike protein. So it's just all so sad, and it's also conflicting. So I have my questions. Now, what would I do about it? Well, throughout all these years, almost 3 years now, we have been using intravenous EDTA chelation therapy that improves the microcirculation of the patient so that the flow dynamics improves. We said get very low on your carbs so the stickiness of the material in the fluid in your plasma doesn't get sticky with too many carbohydrates like gum sticking to your shoes. We use systemic enzymes that have the proteolytic enzymes in it, and we did that immediately when this all broke out. We made sure that people had their vitamin D levels up to a level of 80 to 120, and many publications show that anything above about a 60 was very preventative or markedly diminishing the impact of it. We had all our patients long before this ever happened on a low carb diet. We had our patients all on a good multimineral rich in zinc in their multivitamin. And we all recommended, especially when this came out, but we do it seasonally, quercetin, which is our favorite product that we carry here is called DHIST by Orthomolecular. It's called our seasonal allergies. It's rich in quercetin, clinically tested, and that helps work as a ionophore, which helps a passage into and through the cell membrane so that the zinc can get through the cell membrane. Zinc doesn't easily penetrate a cell membrane. And once you have a good enough intracellular inside the cell zinc level, it inhibits the transcription of all viral illnesses, no matter what they are. So that's what we do. We just give people these natural things. EDTA chelation has to be by prescription. And drink plenty of water, low carb, taking a walk. And that's the methodology that we use. Some people we do give ivermectin or hydroxychloroquine to as well. And I have used zithromycin, and I have used doxycycline in some, but that's how we handle it. So we had another one come in on the live chat, and it said, Dennis, what do some smokers live well into their night? You must mean why do some smokers live well into their 90s? Well, I think part of that reason is because the environment makes a difference. So if you are a smoker that eats a high carbohydrate diet full of processed foods, you're very inactive, and you're not taking any nutrient supplements, or you don't eat a healthy diet, and you're nibbling all the time, nibbling late into the night, and you don't drink enough water, I think these are contributing factors. So people who get into their 90s in these blue zones, very frequently they have a very social, happy life, marriage, family, their spiritual church attendance. They have meaningfulness. They have a positive attitude. They eat organic or homegrown fruits, vegetables, and farm-raised, meat and fish and poultry. And they are reaping from that and their hard work a low carbohydrate lifestyle. They don't drink a lot of sugar drinks. They might actually drink a whiskey. I've seen even studies where they looked at smokers who drank bourbon, I think it was whiskey or wine. And I think there are many other factors, Dennis, that go into this. My mother smoked. My sisters all smoked. And everyone who I grew up with, except my father smoked during World War II because he was in the fighting force, and the cigarettes were free. And remember, the Surgeon General of the United States of America recommended smoking for relaxation, and Camel's was his choice for a cigarette, filterless, no filter on top of that. So I too succumbed to smoking when I was young, in college, late high school, all of my college years, all of medical school, until I had my first child when I was 28, and that's when I quit. I will admit that when stress came into my late 40s, early 50s, I picked it up again and then quickly stopped again. But you see, the social pressure in our lives is very, very important, and that pressure depresses our immune system. So there's a multifactorial epigenetic impact on a human being far outside of any one toxin. So there you have it. And my mother never got lung cancer, and neither did my sisters, who smoked way into their 60s. And I believe my aunts and uncles all smoked into their late 80s, and I'm not sure that any one of them died of lung cancer. So it's a interesting thing, Dennis. All right, Barbara says, no, I did that one. Barbara went on to add also, good evening, Dr. Ellithorpe. My friend in VA, Virginia, has just been diagnosed with scarring alopecia. She is a 57-year-old. Is there anything besides steroids she can do to reverse this situation? I thank you for your time and help with her wellness. If I had someone with scarring alopecia, I would think that she's probably having a lot of the glands at the base of all the follicles of the hair that are irritated. I don't know if it's a hair dye. I don't know if it's environmental. Maybe she's using various cosmetic items. But anyway, it inflames the root. The root, it's chronic and they scar. So I would use Silsum Blue, which is a selenium-based shampoo. And I would only shower at most once a week. And then I would have her use the infrared cap or light, or get into infrared on her scalp. I would take systemic enzymes to reduce that inflammation. I would have her go on an extremely low carbohydrate diet, because sugar, starch, fruit sugars all depress the immune system. And she could spray, or she could rinse her hair in 2-3 ounces of Argentine silver, a little bit of a nanoparticulate silver that is 23 parts per billion. I think you can get this as sovereign silver. Or just spray it on the hair, and it keeps the bacterial fungal count down. So if you lower the sugar, you help your immune system. If you take the enzymes, they work to be anti-inflammatory little Pac-Men. If you use Silsum Blue, that's a natural antifungal selenium-based shampoo. If you use Argentine silver, that's a natural antiviral bacterial fungal disinfectant. And then if she did the infrared, that stimulates into the scalp about, a centimeter. And I think all those things are, and I also would do EDTA chelation. I would do intermittent fasting, because when you don't eat for 18 to 20 hours a day, let's say you only eat in a 4-hour window, your growth hormone and repair hormones become much more dominant, your natural growth factors. So that's what I would do. And hopefully she finds a functional dermatologist. Next one is Jennifer. What do you recommend for face cleansing that is fragrance free? I have very sensitive skin and prefer not to use any chemicals. I don't ever wash my face at all. The only time water or any soap gets on my face would be, once every few weeks when I take a shower. So that's the best way. God knows how to exfoliate your skin and keep it clean. At most, I would splash cold water on it in the morning. You could spray the Argentine spray to your face, and that is a broad spectrum antibacterial, antiviral, antifungal. But it's clear, it's non-reactive, it's water with a little bit of 23 parts per billion silver in it. That's quite safe. So be on a very low carb diet and drink plenty of water. Maybe find out what your food allergies are. Usually sensitive skin is a gut problem with food allergies. So find a functional doctor that can do some gut testing for you. Helene says, does taking honey with morning tea break a fast? Yes. Sorry. Also, how do you feel about using dairy in our diets? Well, you see, what you see in a container at the store that is white fluid, you call it milk. I call it processed junk fire water. Because when they homogenize and heat it up, pasteurize it, they've turned the natural product that comes out of a cow, we call milk, true milk, and they cook it and they shake it so that all the fats now don't naturally rise to the top, and it becomes an inflammatory fire water drink. So no, I don't recommend dairy. If you're going to have dairy, I recommend raw dairy. And I recommend you use it maybe only every fourth day or once a week. So that's how I feel about dairy. Kathy, hello, Dr. Ede. 2 years ago, my husband, age 67, had a mild non-STEMI myocardial infarction with stent placement. Please discuss how enhanced chelation would be of benefit to him. Thank you. I think the best way to do that would be to say it improves microcirculation. EDTA pulls out those free radical heavy metal toxins. It also works as a natural anticoagulant. It also works to enhance nitric oxide synthetase that is in the cell membrane. These membranes have all kinds of responsive chemical plant sensor system lining the blood vessel. And if you can create a favorable environment in your blood system, in the cavities of all your capillaries, that nitric oxide synthetase enzyme will help nitric oxide be produced, and you'll get wonderful vasodilation. So there is a video called Trial to Assess Chelation Therapy. It's just the letters TACT, TACT Update 2019, Dr. Lamas, Lamas, the principal investigator for this. And he goes thoroughly as a cardiologist how it changed his practice and reduced the risk of further heart attacks in his patients that they followed during the test over 10 years. They watched 1,708 men and women, but mostly men, who had heart attacks and were on the standard of care therapy. Many of them had stents. And they found that those that got chelation and took a nutraceutical antioxidant multimineral tablet really reduced their risk for re-injury by more than 50-some%. So watch on YouTube, TACT Update 2019, Dr. Lamas, Lamas. Now, when you see that pop up on your video selection, about one picture lower or two is the ACAM lecture by Dr. Dorothy Merritt, Merritt. She did an excellent summary of the biochemistry and the history of heavy metals and how we get them and how it's linked with all-cause mortality, especially heart disease, and its correlation with the oxidative damage of the lining of the blood vessels. So please watch that one also. That'll be very beneficial. Let's see. Yes, Joanne says raw dairy. Yes, if you're going to have it raw. Donna, I occasionally have a split in the skin of my perineum. I am 67. a TLC patient and am on lots of supplements, bioidentical hormones. I'm not straining with a bowel movement and does not happen during sex. It just sometimes appears out of nowhere. I treat it with silver or vitamin E. What causes this? Well, we think that there's probably in the lining of your cell membranes a need for more protein and healthy fats. So I don't know what your blood type is, Donna, but I would maybe go on a carnivore diet or almost carnivore and just really put down the organic fish, turkey, chicken, beef, eggs, and meat. And then use your digestive enzyme and use the parent essential oil clinician's preference, and maybe use it's 2 twice a day, maybe use 3 twice a day to get in these essential fats and the fats that are important here for holding on to the proteins in the structure of the cell membrane where the proteins are, so it doesn't break down. It's all about the house we live in, the cells we live in are 50 trillion cells. You could have the best antioxidant in the world, the best mineral, the best amino acid, but it's not going to do you a bit of good if it isn't into a well-structured cell membrane and intracellular membranes and nuclear membranes. So that's what I would do. Oh, Carol. Hello, Dr. Ellithorpe. I had blood tests this October. My liver enzymes, and she lists them, Alk Phos 148, that's a little high, AST 65, a little high, ALT 86, a little high. I'm 78. Should I be worried? Is there anything I can do to help me? I am a patient at TLC. Thank you so very much. Well, Carol, again, this is not to be used for advice just to you alone, but I would say most Americans are getting what we call non-alcoholic fatty liver disease. And the kids are getting it. And that's what's even worse. How would you like to be 12 and facing a liver transplant because everyone lets you eat all the pizza you want, all the ice cream, all the gummies, all the candies, all the cupcakes, all the Dorita Cheetos, all the junk food that you wanted. And you wound up becoming liver toxic with all this high triglycerides and blood sugars and getting too chubby, and the liver couldn't keep up detoxing, and the liver enzymes go up and they scar and get fibrotic and you get liver damage. So I think this is probably not serious, that you should be followed up with your doctor. You should go on a extremely low carb diet. Try, if you could, be just a carnivore for a month or two, and then use your digestive enzymes, and then repeat that test by lowering your carbs, of course, no alcohol, and then that should turn it around. But do follow up with your doctor on that. Okay, Carol? Kimberly, my 20-year-old son was just diagnosed with mono. He has likely already had for a couple of weeks. His symptoms are fatigue, recurring fevers. He is a musician about to go on a tour. He's wondering if he'll be up for it if it will set his recovery back. What do you think he should be taking to recover? I would eat in a 4-hour window. I would eat a largely carnivore diet. I would take the vitamin D, probably 15,000 international units a day with K2. I would take vitamin C powder in the water, the Vitality C, 1 scoop at least twice a day. If that gives him diarrhea, then use it once a day. I would, but try and use as much vitamin C. So vitamin D with high dose vitamin C on a very low carb diet stimulates the immune system, especially the antiviral T cell killing impact, and really clears up these viral illnesses nicely. Quercetin in the DHIST, if you took 2 twice a day, and TLC multimineral that has a high zinc. So that will help penetrate into the cell membranes, the zinc, so it'll stop replication of viruses, viral illnesses, and eating a very low carb diet with systemic enzymes for the achiness. And you have to drink half your weight in pounds as ounces of water, and that should help him along. But if he isn't getting better, he needs to see a doctor. Katie says, how do you feel about protein powders, protein bars? Are they a healthy source of protein or too full of other processed additives? Do you have any recommendations? Well, Katie, I worked with our team here to develop a doctor's nutrition bar. And I did that because I wanted to get the right fats in the patient, rich in the essential fatty acids, linoleic and alpha-linolenic acid. And to do that, I had to create my own bar because nobody was eating enough meat or chicken or fish or eggs or anything. So I created this protein-rich bar, but I still don't recommend eating it every day. You see, we're so lazy. We're, as a people, we want to reach our arm, pull off a paper, or reach an arm, pour out a powder, and then voila, we have wonderful, perfect, excellent results. And it doesn't work like that. Life is messy. There is no perfect bar. I don't even recommend my own doctor's nutrition bar every day. I recommend it to be used as a replacement so you won't buy some bad food to keep it in your purse or something like that as a preventative from a worse choice. But out of all the bars, mine is the only clinicians clinically evaluated, tested, laboratory process for insulin and glucose, and its effect was fantastic. Now, I don't have the bar right now, but you see, with the supplies and COVID, we had issues. And then I wanted high quality. So I am insisting on quality. So I don't have them right now. We should have a product in early November, so not too long. And we will start production up again and maybe have the regular thing by Christmas for Christmas presents. And boy, would that be nice. But so no, I don't believe in protein shakes. I don't believe in protein bars. They're really just masquerading as candy bars. So we have to be big adults and grow up and learn how to stop eating, feeding a sweet tooth. We've been trained that way. We've been marketed to that way. They've tricked us and made us addicted to these high sugar, high fructose corn syrup. So we have the ability to say no, and we have to work on that. Marcia says a 72-year-old male friend was exposed to Agent Orange for 18 months. He got prostate cancer, had his prostate removed, and now 10 years later has bone cancer. What are treatment options besides chemo and radiation? Marcia, that is too big of a question. That's something where you need to be talking with a functional doctor. If he has cancer, he has to be managed and treated by an oncologist. It's illegal in California for a non-oncologist to suggest treatment for any cancer, let alone prostate cancer. Now, if you see a functional medicine doctor, they will give you suggestions about how to build up the immune system, how to detoxify, how to improve nutrient activity like that. And so you need to get with a good functional doctor. And then you need to work with the oncologist and look at ways to, there's a book, there's actually a YouTube video called Cancer is a Mitochondrial Metabolic Disease by Dr. Thomas Seidfrey, Seidfrey. And I think he's at Stanford. I'm not sure where he's at. He's a PhD. And he's very controversial because he's claiming, like Otto Warburg said, the cause of cancer was a oxygen deprivation chronically to the mitochondria. It's an energy mismatch metabolism. And so I believe there's more to it than just that, but that YouTube video is very interesting. It's worth watching. And then you can talk with the oncologist about that. You can bring it up to your functional doctor. And certainly getting a low carb diet would be one of the key features, because a high carb diet is a sure way to clog up the capillaries and choke out the cells. We would also be advising a good vitamin D level. We would be advising building up your immune system, your nutrition, maybe some high dose vitamin C, EDTA chelation to improve the circulation, things like that. So there you have it, Marcia. Amber, I have been on bioidenticals since my late 30s and still using them now at 45. Is it safe to continue using bioidenticals forever, or will I need to wean myself off of them at some point? I use the estrogen patch and oral progesterone. My sister's doctor has her on the same patch and told her she can only use it until her mid-50s. I disagree. I'm starting my 70s now, and I've been on hormones since roughly my late 30s, early 40s, because I went into menopause way too early from all the stress in my life. And I just didn't let myself get hot flashes. And so I'm doing very well, thank you. And my bone density is perfectly normal as I hit 70. And I'm strong as an ox with good muscle tone. So I told my family jokingly that if I die, make sure you put some of my estradiol cream and my progesterone cream, these are mine right here, into the casket, just in case I need it on my way to heaven. Yeah, I got a ticket paid for me by Jesus' death and resurrection. So thank you, Lord Jesus. But yeah, I think you can be on hormones all the time. You know, I come from a Christian point of view. That's my worldview. I don't think God ever meant for men and women to die. That means we would have been healthy. That means we would have always had our hormones. That means we always could have elected to have a baby. You know, I'm 70 now, but I would love to have another child. I think children are wonderful. And maybe Eve would have said to Adam every 500 years, let's have another one, honey. You know, and I think that's good, healthy, wonderful, and just delightful. Hormones are helping your bones, helping your mental acuity, your memory. They are helping your immune system. They are helping you cardiovascularly. Hormones help you with your mood. Hormones help you with your sleep. Excuse me, hormones are wonderful, and they are not the cause of cancer. So yes, I think I'll be taking it all the days of my life. And if the good Lord allows me to stay working as a doctor and helping his dear, wonderful creation, you people, because I believe you're made in the image of God, and therefore I don't care what your politics or your beliefs are. I have to treat you as the wonderful creation I see that you are, made in the image of God. So that's how I roll. That's how my life rolls, and it rolls with. I roll it on with my hormones. All right. Okay, let's see. A little joking there. Christine, can you get an adequate amount of vitamin D from getting sun exposure, or a supplement still necessary? And does it depend on age and health? You have to use a supplement. And yes, even the kids need it, because I have lifeguards here from Newport Beach, and they are low in their vitamin D, and they're in the sun all the time. So they have the stratospheric geoengineering chemtrails with the nanoparticulate metals to try and block the sun rays. So you think you're getting it? No, you're not getting it. Yes, you need a supplement. All right, I've seen you comment on a few of your question and answers that certain types of food impact people with certain blood types. What are your recommendations for someone who has A positive? Can you recommend a book or a website? Thank you. No, I can't recommend a book, and I can't recommend a website. Because this isn't taught formally This is part of being a good doctor, clinician over decades. Your blood type, you can't give your blood to someone else as much as you love them if your blood type isn't compatible with theirs. So our blood type has something very important about our immune reaction, and all this white blood cell lines our gut here. So when you're taking food in, your immune system and your blood, about a third of your blood rushes to your stomach when you eat because of the potential immunogenetic stress that your food is that you're eating. So they're making food lousy, the industrialized farming, genetic modification, the glyphosation, the uh, all these things are making food horrible, high fructose corn syrup, ruining your immune system with high sugars. So, yes, your immune system is one of your vital signs that defines who you are and how you react with the world. It's just a fact. And so every doctor should know what your blood type is. You should know what your own blood type is. So we find as clinicians that blood types tend to have certain liabilities. Like A's tend to not digest their food as well, especially if it's protein and fat. Then the A's shun it and they move toward vegetarian lifestyles. And then they miss all that wonderful fat and protein, and they start having weaker cell membranes with more holes in it, and they succumb to illnesses and anxiety and neurological and problems, in my personal experience as a clinician. Now, some A's are worse than others, okay? But in general, most of my patients are blood type A. I don't advertise for blood type A, but if you can't digest well, then you're starting out behind the 8 ball. And why this is not taught in medical school, I have no idea, other than to think it is planned that way, possibly. And so I would tell all my A-type blood people that the book by D'Adamo, Eat Right for Your Blood Type, has foundationally the right concept, but then I think he sells us out by trying to sell vitamins for different blood types. I just think that's wrong marketing. I'd rather see all my patients eat well, exercise, drink water, go to bed on time, give up these bad smoking, alcohol, drugs, sing, dance, socialize, get a hobby, contribute to their communities, watch their health go up without one vitamin given. So, yeah, I think D'Adamo's book conceptually is correct, but I don't like what he's done with that and making money off of it in that sense. So there you have it. Danielle says, I've been diagnosed with fibromyalgia, spinal stenosis, epilepsy, cerebral palsy. I think that was spelled wrong. Partial paralysis on the left side, arthritis, and I have jaw issues from medical abuse. And some of these issues stem from medical abuse. I was on 20 plus medications, so my immune system is low. And I want to ask, how can I get my health restored from all those things? Danielle, you need to come and see someone with experience like myself. Find a good functional health doctor where you live, or come here. We have about 7, 8 of us healthcare providers all working very hard to think outside of the box, and yet use standard of medicine and our consultants, specialists when necessary. But I have seen miraculous things happen. And so I would give you hope, work with a sincere doctor, and let healing take place, have a positive attitude. Terme says, which brand of colostrum do you recommend? Is it okay for someone who is lactose intolerant to take it? What are all the benefits of taking it? Thank you. Well, colostrum is really great in mother's breast milk, and hopefully your mother gave it to you when you were a baby. Beyond that, I am not a fan of a lot of dairy products as adults, okay, as grown children. So colostrum is meant for babies, okay? Now, a little, 180-pound cow born, newborn, turns into a 2,000-pound roughly animal, or I don't know how many, but hundreds and hundreds of pounds heavier. And that little baby is drinking mother's milk to get hundreds and hundreds of pounds. So you don't want to be a big dairy consumer, I don't think. And then that baby itself stops eating the mother's milk and goes to eating grass itself. So I'm not going to be recommending colostrum. Hi, Dr. E. I have ear pain on the left ear, clicking noise in my ear. I get a headache and feel off balance, lightheaded. I saw a local doctor today and he ruled out ear infection, but said I have some fluid behind my ear. He prescribed levocitrazine, 5 milligrams, and prednisone. Can I address this holistically, or do I have to take the medicine? Yes, you have to follow the doctor that you've seen. I don't know what your ear looked like, and it may be very well that everything he gave you is exactly what you need. Now, what you have to do is see someone who will work out, why did you get the ear infection? Why are you accumulating fluid? Why is the eustachian tube from the back of your throat to your ear getting inflamed? Is it food allergy? Is it a high carb diet? Is it lack of water? Is it lack of enzymes? Is it your blood type? All these things have to be looked at. So that's what I would say, Amela. Patricia, I'm trying urine therapy and wondering what your thoughts are on it. Well, I smiled and chuckled, so you know my thoughts on it. I drink about 4 big gulps of my morning urine. Well, Patricia, I hope you get a powerful result from that, because I'm impressed with your courage. I've read about that 20, 30 years ago, and I know many cultures have this as a tradition, and it is sterile. It is something that I might do if I were starving on a desert plain and had nothing to drink. I probably would at least resort to drinking my own urine. But I have no recommendation that it is of any true functional benefit in and of itself. So I'm going to say, good for you. What a strong person you are. I predict long life and good health for you, because if you're capable of doing something like that, you're someone who is going to plan your own life and eat your food in safety and health and exercise and do other wonderful things for yourself. I'll do all of that, but not drink the urine. Good for you, Patricia. Sue, hello, doctor. Thank you so much for your devotion to us patients. Well, we praise the Lord because he devoted his whole life to give his life up for me. Why wouldn't I do it for you and my family? All right, you have blessed so many. I'm 71 and have osteoporosis. I've been on Prolia treatments. Oh, Prolia, the medicine. Okay, prescription medicine. But this week I was told that I have a severe amount of arthritis on my right hip. I am taking many supplements to include K4, multimin, orthobiotic, hope to delay hip surgery. Well, Sue, I hope that you are also on natural hormone replacement therapy, because that's very beneficial. I hope you're on a rich protein and fat diet, low carb. I hope you use your digestive enzymes so you can extract all that repair for cartilage and your elastin and tendons and muscle to hold you up. I hope you're doing weight training and physical therapy, stretching, Pilates, something like that. I hope you're drinking enough water. I hope someone's measuring your vitamin D level to make sure you're getting around about 100 nanograms per deciliter to be stimulating bone rebuilding and all that. Joanna says, hi, I recently listened to a podcast with Karen Hurd. She has a bean protocol. That's a legume. That she ran protocol, and I don't know Karen Hurd, but what I will tell you about beans is that they have a lot of lectins in them, and these lectins in general produce a lot of gas and create tiny little micro tears on your one cell membrane thick lining. It is not a perfect source for protein replacement. That's why I go to, we're made of protein and fats. So I like eating meat, fish, turkey, chicken, beef, and eggs instead of beans. And it's so high in carbs. For the amount of protein you would have to eat of those beans to get enough protein daily. I think we're all joking to think the American Dietetic Association's recommendations for protein consumption and their recommendations on the pyramid are useful. We have 50 years now of chronic disease and worsening and cancer and heart disease and ruined immune system. So their advice stinks. So I would say I would get my protein from the sources from the chicken, fish, turkey, beef, eggs, and stuff rather than the lentils. Veronica. Dr. Rita, my husband is 50, has poor blood circulation on his legs to the point that his legs are now purple on his lower legs and ankles. In the inner part of his lower legs, he has 2 ulcerated spots. They have not opened but look very dry and could open. He doesn't have diabetes, does not have diabetes. Doctors recommend hip and knee replacements. What do you think? Veronica, I think you should see a functional doctor and get this gentleman on EDTA chelation therapy to improve the microcirculation. Watch that video, TACT Update 2019, Dr. Lamas. They're saving limbs and toes and amputations left and right by doing chelation therapy. And let's see, Perry Lynn said, are there any standard tests to detect pancreatic cancers? Nothing specific. Perry Lynn, you're too young to have another baby. Was it Sarah who was 90? Yeah, Sarah was 90 when she had Isaac. And so, yes, I'm too young. I got to wait another 20 years. Okay. All right. There you go. And then Christina, how does one become a functional health doctor? Christina, there is no formal training. Now, there are programs out there. Back in the 1990s, I tried to find a formal training program. I went to Capital University of Integrative Medicine, but now it's closed up because there's so much pressure from standard medicine to suppress this knowledge. The college couldn't withstand all the assault, and after about 10, 15 years, it finally closed. But fortunately, I got there in the first few years where it was all exciting and all the European doctors were there and all the Chinese, Japanese, Eastern medicine doctors were there. I was really given a great second doctorate at that place. So in the meantime, naturopathic medicine, become a naturopath, or become a regular doctor. Learn what you have to learn. I mean, I am not throwing the baby out with the bathwater. I use my standard medical training all the time. I respect my specialists. I need my specialists. I refer to specialists. I don't know everything. I'm not God. But I do have foundational premises that I expect everything to be done by, and to enhance whatever specialty or medicine I might need to do to have a greater, better, more short-term outcome. So get with a functional doctor. We do mentoring here. You can come and call the office, speak with management, and tell them you would like to shadow us and see and talk with us for real what a day is like in our medicine here. Now, I better stop. I'm 10 minutes over. Praise the Lord. I've been talking all day, so I've worked all day. I've been up since 5 something. I worked out. Praise the Lord. So hopefully I'll be around for another, at least until I can have a baby at 90. Okay, well, God bless you. Christina, become a functional doctor and talk with us. I'll do these last 4 on next week. So in the meantime, God bless you all, dear creations of my Lord, and God keep you. Like and subscribe, share this, and help others. Okay, take care. Bye-bye.